Today we are going to talk about something more dangerous than high blood sugar. In our previous videos, we have been talking about high blood glucose, high blood sugar, and the dangers and the things that it can lead to. Today, we are going to talk about something that is more dangerous than high blood sugar level. And what is this? You guess right, it's low sugar level. Low sugar level is more dangerous than high sugar level. Why is that? Because if you do not take measures to correct low sugar level, it can lead to serious complications, even coma. So you see, the low sugar level is more dangerous than high sugar level. People that are diabetic are at risk of having low sugar level. This is because they may be on certain medications and other factors that can lead to low sugar level. So an individual is said to have low sugar level, especially for a diabetes patient. You're said to have low sugar level when your blood sugar level is less than 4 millimoles per liter. So anytime you check your blood sugar and it's less than 4 millimoles per liter, is referred as low sugar level, popularly called hypoglycemia. But for people that are not diabetic, low sugar level is when their blood sugar level is less than 3.1 millimoles per liter. But today, our focus is on diabetes patients having low sugar level. So you ask, some will say, I've had several episodes of low sugar level. Some will say, I've never had it. So you can see that means there are risk factors that will make a diabetes patient prone to low sugar level. What are these risk factors? One of it is insulin. If a diabetes patient is on insulin and does not follow instruction carefully, he may develop low sugar level. So what are the instances in which a diabetes patient on insulin will develop low sugar level? One is that if you're using very high dose of insulin than you require, either by the mistake of your healthcare provider or your health professional, or by your own mistake. Let's say the doctor say you should give yourself 10, and by mistake you give yourself 20 international unit, 20 IU as is properly called. There's likelihood that you develop low sugar level. And if you give yourself insulin, for those who are on insulin, and you don't eat after giving yourself insulin, there's likelihood you develop low sugar level. So, but it is not only insulin that can give you low sugar level. Those on certain drugs we call sulfonylurea. I'll give you certain examples like glibenclamide. Example of glibenclamide is the one that most of you popularly know as Downil, Glanil. All these are very strong drugs that can give you hypoglycemia. Like glimepiride, example of that is Paglim, Diapride, and the rest. So these are strong drugs that if you're taking them and you do not eat, or you take them and ignore the instruction given to you by the doctor, there is high risk that you develop low sugar level. So apart from this, if a diabetes patient is sick and his appetite is down, if a diabetes patient is sick and cannot eat properly, there's likelihood that you develop low sugar level, especially not having good appetite and you insist on taking your medication. So the medications that you use for diabetes, their role is to help you utilize what you eat. So if you do not eat but take the medication, there's likelihood that your sugar will go down. All right. So apart from that, diabetes patients that have kidney problem and also diabetes patients that have liver problem, all these ones that I've mentioned are situations that makes a person with diabetes at risk of having low sugar level. So, but how will you know that you have low sugar level? So once your blood sugar goes to less than 4, your body will start giving you the signals to tell you that your sugar level is down so that you quickly take a measure. But if you do not take a measure, it can progress. So some of the warning signs you get are you start feeling hunger pangs, you start sweating excessively, you start shaking, you start having beating of your heart will be obvious or popularly called palpitation. So all these ones I've mentioned, they're warning signs and they are due to certain substances secreted by the body, by the autonomic nervous system to warn you that you need to take something because your blood sugar level is down. But if you do not heed to that warning, then there is likelihood it will progress to involve the brain. And one thing with the brain is that it cannot do without the required sugar or glucose. So once it involves the brain, you start becoming confused, you start becoming disoriented, you may start convulsing, and you may lose consciousness. So the aim of the body is to warn you so that you will not reach to that level in which you start convulsing and lose consciousness. So it is important to heed to that warning if you're a diabetic patient and having symptoms of hypoglycemia. But there's a dangerous state in people that have diabetes, especially people that have developed serious nerve complication. We call it hypoglycemic unawareness. This is a condition in which a diabetes patient is having low sugar level but is unaware. Hypoglycemia, low sugar level, unawareness, you're not aware. And this situation, a diabetes patient may even have very low sugar, he wouldn't know until he will just fall down and lose consciousness. So, but this one is commonly seen in people that diabetes have damaged their autonomic nervous system. So the warning sign that will alert them, eat something is lost. So if you find yourself in a situation where you are having excessive sweating, beating of your heart, dizziness, you are shaking, quickly check your blood glucose with your glucometer. And that's why I've said in my previous videos that every diabetes patient needs a glucometer, that meter that you use to check your blood sugar. Because there are other things that can give you sweating apart from low sugar level. There are other things that can give you beating of the heart apart from low sugar level. So you can agree with me that it's very important that every diabetes patient should have that glucometer. So once you check and you confirm your blood sugar is low, you do something about it. That's why I've said a diabetes patient is advisable, if possible, not to stay alone. Because sometimes you will develop severe low sugar that you cannot help yourself and you need someone to assist you. What if you're staying alone? What could happen? Right? So if you check your blood sugar when you're having those symptoms of sweating, shaking, and if it's less than 4, quickly get something to eat. And this is the only period in which a diabetes patient is allowed to take things that contain sugar. So you can take 1/3 of any soft drink, you can take of table sugar, you can take 1 honey, you can take 1/3 of fruit juice, any fruit juice. You can take glucose tablets if you have it. You can take 2 to 3 cubes of sugar if you have it. So if you take these ones, you wait after 15 minutes, you check your blood sugar. If it has gone up to 4 and above, that's the right time for you to look for something and eat. But if it's not up to 4 still, repeat the process. Right? And if you repeat the process up to 4, please look for something to eat. But take note that if it is persistently with all your effort not going up, please go to the hospital. Another reason why you may need to go to the hospital is if you are caring for someone that is having low sugar and is convulsing. The best option for that patient is to go to the hospital to receive sugar through his veins. So this is how to handle low sugar level. So it is important to take it very seriously, because if you delay in correcting the blood sugar, it can affect the brain. And when you convulse and maybe lose consciousness for some time, even if you take that individual to the hospital, he may not regain consciousness because the brain damage has become permanent. And once the brain damage has become permanent, there is nothing to be done to reverse it. I hope we understand that hypoglycemia it is as dangerous as hyperglycemia, meaning low blood sugar is as dangerous as high blood sugar, even more dangerous. So take care of yourself, check your blood sugar always, and whenever you have low blood sugar, take the measures that I've mentioned. If you enjoyed this video, kindly give me a like, share this video, and please subscribe so that anytime I do a new video, you'll be the first to watch and you encourage us to continue what we are doing. Thank you.